their living rooms, it is in their schools. And immediately it becomes clear to people who understand health disparities that Black people, Latinos, Native Americans, that they are going to be in for a rough ride.
We have a particularly difficult problem of an exacerbation of a health disparity we've known literally forever.
I'm Keisha Johnson Hargrove. Jason Hargrove was my husband. He was a bus driver for the Detroit Department of Transportation, and he absolutely loved what he did for the citizens of Detroit. He put that blue uniform on every day, proudly, leaving the house 4 a.m., 5 a.m., 6 a.m., sometimes doing double shifts in a day for little pay. His service was big for him. He loved being a provider for his family, so he did it with pride. Normal day, raise our beautiful children. We have 5. School, work for the both of us. Church. The incident that Jason had on his bus, this particular day, he complained about a female passenger who very carelessly would just outright cough repeatedly on the bus. She was not masked. She used nothing to cover her face, and it upset him very much. Let me go into his video. The crazy part is I have never watched the whole thing. Okay.
Hey, look, listen, man, let me say something. This coronavirus is for real. And for you to get on the bus, grown-ass person, and cough 4 and 5 times without covering up your mouth, and we in the midst of a crisis. And they telling you every day what to do. Cough in your arms, sneeze in some tissue. That don't make no damn sense. And I mean that. That was disrespectful. Disrespectful. Damn. What the hell? Oh, man. But I gotta get out of here. I gotta make this run. Y'all be safe. If you ain't got to go out, don't go out. If you go out, cover up your face, put some gloves on your hands. Please. Damn. If you see somebody coughing and they don't cover up, bust them in the back of the head. I'm out of here, y'all. I love y'all. Peace.
A couple of days later, his temperature was 101. I took him immediately to Sinai Grace Hospital. They gave him a prescription for cough syrup. They told him to go on a 14-day quarantine. They never tested him. By day 4, Jason had extreme chills. He can't smell, he can't taste, he's coughing, he has a fever, and he now has diarrhea. Jason held his hands up to me, and he said, "Baby, look, I'm blue." I take him to Sinai Grace. He says they listened to my lungs, and they told me my lungs were clear. They told me that my fever wasn't high enough. It was only at 99. And that the color would come back in my hand. So if this man is working out in the public every day, why don't you test him? I didn't understand that. The next day, he began to cough extremely bad. He says, we're going to go to Sinai and I'm going to be okay. My son, Darshan, pulls up to the door. He lets them know that he needs oxygen. They send a wheelchair out. They take him in. They won't let him go in. He's like, please, I want to stay with my dad. They tell him he can't come in. We'll take care of him. I call and I call and I call. My husband's been there all night and I haven't heard anything. Can you have him call me? At least just have him call me. And she says, well, Mrs. Hargrove, he can't talk to you because he's on a ventilator. How could this even happen? Like, what? No calls? He's been there now for 9, 10 hours. I keep calling. They tell me as soon as he gets a bed, they'll give me an update. Jason has been in Sinai Grace Hospital now for 2 days. They finally tell me he has a bed and he now has a nurse assigned. And they transferred me to the nurse. Nurse gets on the phone. She introduces herself. She says she's Nurse Cheryl. Any changes in him, she would contact me. She said she was standing there with him at the moment, right then. And she says, your husband's looking good. She says, I know that sounds a little crazy because, yes, he's on a ventilator. She was like, but everything looks good. The next day, April 1st, I make the call, and immediately the first receptionist tells me they don't have a Jason Hargrove.
You may have noticed a lot of calves on vacation.
I declare before you all that my whole life shall be devoted to your service.
They said he's in room da-da-da-da, bed da-da-da-da. So she says, okay, I'll transfer you to that department. They transfer me to the department. I do my spiel. Hi, Deisha Johnson Hargrove. Just calling for an update on my husband, Jason Hargrove. The nurse says, Mrs. Hargrove, I need you to call back in 30 minutes. The nurse is busy. Sure, I will. So 30 minutes go by. I call back in 30 minutes. I now have a different receptionist. I don't have a Jason Hargrove. I give him the same spiel of where he is. He says, I'll transfer you. They transfer me. I get the same nurse again who says, can you call back in 30 minutes? I said, absolutely not. I will not call back again. I just want an update. You've had me call back already. I just want an update on Jason Hargrove. The nurse put the phone to the side. I hear her speaking with someone in the background, and she's saying, bed 11. And they tell her to tell me to call back. I said again, no. She says, Mrs. Hargrove, I need to let you speak to the doctor. Mrs. Hargrove, your husband didn't make it. Mr. Hargrove has passed. Jason was in the hospital from Sunday till Wednesday. I never received any information from the hospital. If it hadn't been for me calling them, I wouldn't have known anything. My husband had died. He has passed away. And I never got a phone call. They told me April 1st that my husband passed. When I received the death certificate in fact told me Jason Hargrove passed on the 31st. My husband lay dead all of those hours, a whole day before my call to the hospital to even find out that he had passed. Here is a man who loved me. He did not play about me. You know, He protected me at all costs. I'm used to being his wake up and his good night. He was my every day, my every single day. And to not have him here with me it just does not feel right. It just doesn't. So Sinai Grace, as well as the woman who coughed, shame on you.
The story of public health in America wouldn't make any sense if you didn't understand the story of race in America.
The institution of slavery required putting a value on people's bodies, and the folks who did that were physicians. They profited on doing that, and they profited on creating a science, almost a pseudoscience. Even up until the late 1850s, if you're a Southern physician, this is like a core competency to be able to evaluate people's bodies that way. And when you do that, part of the value is their progeny. So they were also evaluating their reproductive potential.
Everything in our country has been created at a time when slavery was the main driver and the main economic engine of this country, so medicine was as well.
Slave women had surgeries performed on them, obviously without their consent, with no anesthesia, where they bled to death. They were permanently scarred so that the surgeon could get it just right before he did it on a white woman.
African Americans with a very long history, a very troubled history with medical experiments.
There's a surgeon named Marion Sims, who is regarded as the father of modern gynecology as a field. And most of the surgeries, including some of the instruments that are named after him today, are based on his experimentation with black bodies, which he justified based on this idea that black people experience pain differently.
And of course, the Tuskegee experiments and syphilis being tested on black people.
The United States Public Health Service conducted a study beginning in 1932.
Voluntary participant in a human experiment on untreated syphilis.
Henrietta Lacks, her cells are used for development of all sorts of different medicines and research, and she's never even told about this.
There was Holmesburg Prison, where black men were experimented on from great scientists at the University of Pennsylvania. Black folks, we don't go to the hospital until we're sick. Why? Because we don't trust. Because there was surgery being performed on us without our consent from the beginning of time.
When I really got into the details, of course, it was shocking to understand how the institution of slavery and its legacy influenced my field. For example, most textbooks only have images of white people. in my field, one of the leading causes of morbidity and even death is hemorrhage. And the way that you know that somebody's lost a lot of blood is that they look pale. But if they're melanated, it's not totally clear that they exhibit paleness in the same way. And so you might be less likely to notice that in somebody who is not white. And you might not mean it, but that's just sort of how you've been trained. You've only been looking at textbooks with people who are white-skinned. But I think for many of us, we think of racism as something that's outside of our present institutions, especially ones that are rarefied, like medicine.
Structural racism is pernicious and is pervasive, meaning you can't see it's not so obvious and it's everywhere, right? So it turns out, for instance, we have a long history in our country of redlining, of not allowing Black people to live in certain neighborhoods and really pushing them into other neighborhoods. Which neighborhood you live in has this profound effect on your health.
Your health care most depends on your zip code. That's the biggest indicator of how long you're going to live, the quality of health care you're going to have, what illnesses you'll suffer from. It's your zip code.
The air you breathe has this big effect. Air pollution is not randomly distributed across every neighborhood and community. What we know is communities of color, where they live, there's much, much higher levels of air pollution. Bus depots are often placed in those communities. Factories or things that will emit more air pollution are often placed into those places. Is that random? It's not random at all. It affects respiratory disease, asthma, and COPD, and heart disease. It just happens somehow that there's more asthma among Black kids than white kids. We don't know why. Well, we do know why, actually.
So how do you explain that? America, I would say, how do you explain that?
Health care facilities in neighborhoods that are poor may not have the resources that they need to have MRI scans and CT scans. And so for these many reasons, we came into COVID with such health inequities.
My father's engineering ring. So this is like the last piece of him that I actually really have. They were asking him to okay the trucks, the weight of the truck limits to go over the bridge to come to bring COVID products over, like masks, sanitizer, and stuff for the hospitals. And he had to be there. He felt like, this is my job. I'm an essential worker. You can't tell me to be, that's what he'll tell my stepmother. You can't tell me to stay home. You're going to tell the governor that I'm staying home because you told me to stay home? I'm an essential worker. I have to be at work. So he didn't even make it, like, after he hit the hospital, not even 24 hours. And being in the hospital, he passed the next following day.
If you think about who are the essential workers, who we said, despite the fact that things are terrible, you still need to go in, they were disproportionately Black and Latinos, but let's talk particularly Black Americans. They didn't have the luxury of zooming in from home for their work. They were in the subways, they were going to work at the height of the pandemic.
COVID-19 divided the world into people who could protect themselves and people who could not. And that was not just true across geopolitical borders, it was true within neighborhood blocks. And that was based on what people do for a living and whether or not they were valued in terms of being protected. And it was based on the housing that they had access to and how crowded they were. It was very dependent in New York on how much they relied on public transportation to get the basic things that they need, like food. And it was based on how they have always been treated by American medicine.
The Institute of Medicine came out with a report looking at systemic inequalities in medicine. They describe the many ways that individual racism can come into play. Pain management, coronary artery bypass, graft surgery is not being done, curative lung cancer surgery is not being done, mammography is not being done, like just all down the line.
We may need to use the term unconscious more. They are not even known to the person that is exhibiting these issues.
My approach to getting individual doctors to make change is, I always tell people, look at your own data. Okay, you think that all your patients care about, think that they're getting good care, being treated with respect. Do a survey of all your patients. Ask them if they all feel respected. Ask them if they all feel heard. Ask them and look at that data broken down by race. And see if there are some people in your panel who may not feel as respected, as heard, as cared for as you think you're trying to do. And I'll say, I understand. You don't feel like you're a racist. I don't feel like I'm a racist. I feel like I treat everybody the same. We all do. So explain to me why there's such different outcomes. Most doctors and nurses, if you ask them, of course they're going to tell you they're not racist. Of course they're going to tell you they don't stereotype. And I think most of them actually believe that. Then you look at the data, you begin to unpack it, look at it nationally, look at it locally, and then you can tell stories with it that help you move the ball forward.
There's a very, very fine line between what we celebrate as clinical intuition and what can be effectively racism. We actually have quantitative algorithms that determine treatment based on race. Those kinds of algorithms that sort people based on their needs can actually be a really good thing. And not only in terms of providing good care, but in terms of holding the healthcare system accountable. Because at the end of the day, we have to have a definition of what good quality care looks like. Part of what makes medicine, and American medicine in particular, something to be proud of. But all of our math that we use to predict how people are going to do is based on the past. And if the past circumstances are based on racism, or based on things that are not right, or things that could be improved, what we end up doing through those algorithms is perpetuating those very differences. Black people are quantitatively less likely to get treatments that they might need, because this calculation affects everything from how you dose drugs to whether or not you're eligible for a kidney transplant.
I think what is clear in the data, if we just stick to the data, is there are two groups whose health outcomes consistently are among the worst, and they are Blacks and they're Native Americans. And Native Americans are a very small group of Americans, and so in most national studies, they just don't have a lot of people in those data, and so they tend not to get the same focus. And so you end up with the group that really ends up having pretty poor outcomes across every stage of life, and that's Black Americans.
Go to the hospital and get this breathing right, and I'll be right back. And she deteriorated. I think it was a Sunday. And she deteriorated like so fast. By like Tuesday, she was on the ventilator, Thursday, kidney failure, Friday, swollen the brain, and she just fought for the next 4 weeks.
My husband would call and saying, they dismissing me out the hospital. I'm like, dismissing you out the hospital? He said, yeah. I said, well, why would they dismiss you out the hospital? Are you feeling better? No. We picked him up. He was so weak, he couldn't even get out the wheelchair, and the guy wouldn't help him. So I had to get out, help him get in the car, and bring him back home. He was weaker going home than he was when I brought him to the hospital. So Tuesday, I said, well, doctor, we just gonna have to go back to a hospital. And he went on the ventilator sometime that Wednesday night. And that was the last conversation that we got a chance to have. They lost him. Yeah. My heart is just torn. I've never been alone, So all of this is, excuse me, very new to me.
Racism disguises itself as medicine when you don't give the same care to your Black patient that you would want for your mother, for your sister, for your husband. When you don't take the time to explain a complex procedure to them because you believe that they A, can't afford the operation, they B, don't understand the complexities, and they 3, won't follow the post-operative care. So you don't even offer it as an option. Whereas the white patient, you've explained option A, B, C, maybe even something experimental, but you don't take the time to explain it to your Black patient. And that is evidence-based. That's proven, and the Institutes of Medicine say that white doctors spend less time explaining complex procedures to Black patients. Why? Because we're not smart enough? You think we're not going to get it. You think we won't agree to doing it. So why waste my time explaining it to you?
There are 2 main therapies for people with advanced kidney failure. They can go on hemodialysis, where they get dialysis 3 times a week, or they can get a kidney transplant. Kidney transplant is superior. It's much, much better. Obviously more painful up front, but once you get the transplant, you can essentially live a normal life. What we know is that Black people are much less likely to get a kidney transplant than white people. So the question is why? When you do surveys of those doctors and say, why do you make the decisions that you do? They say, well, I make it based on my assumption of who can go through a transplant and get through it. Because it's a difficult process to go through a kidney transplant. So again, that's that assumption. The doctors are assuming that it's going to be harder for that Black patient to make it all the way through the process. And so therefore, they're less likely to refer. But what we know from the data and from the evidence is that physicians and nurses treat people differently based on their race.